Have you considered having breast augmentation, but the thought of implants kind of make you hesitant? Well, Dr. Bill Johnson of Innovations Medical is here with helpful information and an option for you. Good morning.
Good morning.
Now, is it true that breast augmentation remains one of the most popular cosmetic procedures?
Breast augmentation and liposuction run 1 and 2 pretty much every year. And one of the main reasons is they can make a big difference on your body shape and size with that exercise just can't. And over the years, breast implants have been around about 40 years, and they're still the big leader. But the last 4 or 5 years, techniques have improved so much in fat transfer that it's really up and coming.
Now, fill me in on the difference in using your own fat with fat transfer as opposed to or versus implants.
Well, implants are the big leader, as I said, but there are some advantages and disadvantages to each. The big disadvantage of fat is it's a lot harder to predict the size and shape.
Okay.
Implants give you a real predictable size and a real predictable shape. The shape on fat transfer is related to what your underlying skin and how much fat we have available. The shape is dictated by the shape of the implant.
Sure.
On a breast implant.
Okay.
So you see a lot more of the melanin rounds nowadays than you used to. Weight changes, if you lose weight or gain weight, that can affect breast size when you're doing fat transfer. The implants are fairly immune to the effects of weight change. Now, the other thing is, we can talk about texture. One of the big advantages of fat transfer is completely normal texture. It has a completely normal shape and look to it. So it's a very natural look as opposed to texture, which can be quite variable with implants. Sometimes the implant itself doesn't feel that good. Sometimes the implants often don't have a normal shape. There's no reaction or capsule that can happen with fat transfer. It's you, okay? It's your own tissue.
It's coming from your body.
And capsules always form on implants. Most of the time that's no problem, but sometimes they can contract and cause other problems. The other thing I meant to put on the slide and didn't is most of the manufacturers on implants recommend they be redone about every 10 years. You don't ever have to have fat transfer redone.
That's quite the bonus right there. Now, I know you've mentioned the shape of the size with fat transfer, but really fill me in on that. Can we kind of maybe aim for a size?
Well, the size kind of depends on the person, because if you're a size 32, okay, chest size, you only need a small amount. 250 cc's is a few ounces, is about a cup, and that will give you a full cup size and increase. If you're 36 to 38, you need twice that much to go into a larger bra size. So this is also true of implants. It's just easier to deliver that increased volume with implants. So the size we get asked about, size is the #1 thing. How big can you make it? And that really depends on how big a person you are. That has a lot to do with how much we can do on size.
Good to know. It is not one size fits all when it comes to fat transfer. But who would be a good candidate?
Well, people that are good candidates are someone that's a A up all the way up to a double D that wants a greater size or more fullness. That's what we hear a lot. Don't want to be that much bigger, just want to be fuller. Want some lift. Women that have experienced some droop with pregnancy, with weight loss, just aging, they're very good candidates. Women that have a difference in breast size, we can often help a lot to normalize that. So all of those are real good candidates for breast fat transfer.
Oh, look at that. And I bet you there's a lot of women coming in that want more of that natural look too. And to make it easier for them, you have a special force this month.
We do. When we add platelet-rich plasma to the fat, we get a 90 to 95% fat survival, so it really helps improve the predictability of our size. And we're going to give, for the rest of August, we're going to do platelet-rich plasma free with breast fat transfer.
Okay, this is a bonus. This is a win-win. Thank you so much, Dr. Johnson, for this really good information and an option for those who want to maybe have a augmented breast. To learn more about the Smart Lipo or the Thermage, call 214-420-7970 for Dr. Bill's Dallas and Frisco offices. Or in Fort Worth, here's the number to call, 817-438-8319. You can also find all this information on his website. It's innovationsmedical.com to set up a free consultation. And don't forget, you can also head over to Facebook to check out Dr. Bill's weekly post.